Hello and welcome to this Foster Care Institute online training webinar. Fetal Alcohol Spectrum Disorder Part 1, Understanding the Disorder. This is the first of a two-part webinar series here at the Foster Care Institute. I'm your host, Dr. John DeGarmo, founder and director of the Foster Care Institute, an author, an international speaker, a trainer, and a foster parent myself. Indeed, over the years, my wife and I have had over 60 plus children come through our home, be a part of our family, and to be sure, we've had many children come to live in our home and stay with our family who have suffered from FASD or fetal alcohol spectrum disorder in some fashion. Our goal during this webinar is to increase a better understanding of what FASD is and how it affects children and the families that care for them. Our key objectives are to increase your awareness of what fetal alcohol spectrum disorder is and an understanding of how it affects children and the families that care for them. A quote from a child who suffers from fetal alcohol spectrum disorder says this: "It's hard to remember when you're in the midst of all of this going on that the reason that they're acting this way is because of the damage that's been done. It's not because they're maliciously wanting to knock your brains out." In their own words. We hear a lot about fetal alcohol syndrome and fetal alcohol spectrum disorder, or FASD. We hear about it in the news. We hear it about it in the media. We hear about it at foster care training sessions and seminars. We read about it in foster care parenting books, perhaps in foster care podcasts. We hear about it in parenting groups. But what is it? What is FASD? Well, FASD, or fetal alcohol spectrum disorders, they're a group of conditions that can occur in a person who was exposed to alcohol before birth. Now, these effects may include physical problems, behavior problems, and difficulties in school, difficulties in learning. In addition, there are many times when a child with FASD has a mix or a combination of several of these problems, a combination of physical problems, behavioral problems, as well as difficulties in learning. What many do not realize is this: each year, as many as 40,000 babies are born with FASD. And this is a cost of over $4 billion nationwide. Again, 40,000 babies each year are born in the United States alone with FASD. That should be a very troubling statistic. That should be a disturbing number. Fetal alcohol spectrum disorders are a lifelong condition, and there are no cures for FASD. It can be prevented, though. Early intervention can be helpful in improving a child's development. It can also be prevented when a pregnant mother does not drink alcohol during pregnancy or before pregnancy. We will look into this later on. FASD can be treated through means of therapy, which can help your child learn how to talk and interact with others. So if you have a child arrive in your home and you believe they may have FASD, talk to your doctor as soon as possible about your concerns. In many states, those children who do have a diagnosis of FASD are immediately eligible for early intervention services. Now, we're going to look at the lifelong treatments and therapies for FASD in part 2 of this webinar series, so make sure you're on the lookout for that webinar. Again, FASDs are 100% preventable. 100% preventable. Quite simply, mothers must not consume alcohol during pregnancy. This includes wines, beers, and spirits. FASDs can occur when a person is exposed to alcohol before birth. The alcohol in the mother's blood system passes through to the baby through the umbilical cord. Now, make no mistake, there is no known safe amount of alcohol during pregnancy or when trying to become pregnant. In addition, there is no safe time to drink alcohol during pregnancy. For you see, alcohol can cause problems for a developing baby throughout the pregnancy cycle. Again, all types of alcohol are equally harmful, including spirits, wines, and beer. Alcohol in the blood system during pregnancy constricts the blood vessels, which slows down the blood flow to the placenta. Now, the placenta is the food supply while the baby is in the uterus. This causes a shortage of oxygen and nutrients to the fetus. Toxic byproducts are produced when the body processes the alcohol through the blood system. These can then concentrate on the baby's brain cells and cause damage. Now, the damage from the alcohol may happen or occur at any time throughout the pregnancy cycle. At any time. The beginning of the fetal development is the most important part for the whole body of the child, and the organs, like the brain, continue to develop through pregnancy. Alcohol can kill the cells in different parts of the fetus, and this results in an abnormal physical development of the child. Alcohol also interferes with the way the nerve cells develop in the baby, how they travel to form different parts of the brain, as well as the brain's functioning. There are several types of FASD or fetal alcohol spectrum disorder. And we're going to thank in advance the FAS Diagnostic and Prevention Network for these following terms. First, and perhaps most commonly heard, is fetal alcohol syndrome, or FAS. This is the most serious type of FASD, or fetal alcohol spectrum disorder. Those children with FAS, or fetal alcohol syndrome, have facial abnormalities, including wide set and narrow eyes, growth problems, and nervous system abnormalities. Partial fetal alcohol syndrome, also known as PFAS. Those children who have been diagnosed with PFAS have some of the characteristics of FAS, but do not have all of the syndromes for FAS. Alcohol-related neurodevelopmental disorder, or ARND. Children with this type of disorder experience some or all of the following: impulsiveness. They are often inattentive and have challenges with judgment and school performance. Alcohol-related birth defects, ARBD. Physical birth defects can affect the heart, eyes, skeletal system, ears, and kidneys. Neurobehavioral disorder, associated with prenatal alcohol exposure, NDPAE. The child is exposed to more than a small amount of alcohol as a fetus. The child thus has difficulty or tremendous challenges with daily tasks, such as bathing, getting dressed, tying shoes, as well as can struggle in social settings because of the significant behavioral issues, such as severe forms of tantrums. In addition, a child with NDPAE also has difficulty with thinking and memory. A child with NDPAE may be told or may learn something in a morning and by the afternoon may have difficulty in trying to recall that information, or again, difficulty with thinking and memory. One parent says this: with him, there was just never any. There was no natural internal clock, and there was no forcing an internal clock. It's all the same today. He will stay up, and I've just learned to not let it bother me. This is a parent who has a child with FASD in her home. So, what are the signs, what are the symptoms of fetal alcohol spectrum disorder? According to the Mayo Clinic, the severity of fetal alcohol syndrome symptoms varies. Some children will experience FASD signs and symptoms to a far greater degree than other children. It depends upon the child. Signs and symptoms of fetal alcohol syndrome may include any mix of physical defects, intellectual or cognitive disabilities, and problem functioning and coping with daily life. Again, it varies from child to child. There are physical defects, distinctive facial features. These may include small eyes, a thin upper lip, a short upturned nose, smooth skin surface between the nose and upper lip. There may be deformities of joints or limbs and fingers. There may be slow physical growth before and after birth. A child suffering from FASD may also have difficulties in vision or hearing problems. Along with this, some physical defects of FASD may also include a small head circumference and brain size. Finally, there may be heart defects and problems with kidneys and bones. FASD signs and symptoms in regards to brain and central nervous systems include poor coordination or balance, intellectual disability, learning disorders, and delayed development. As noted earlier, a child with FASD may show signs of poor memory and may show signs of trouble with attention and with processing information presented to the child. Brain and central nervous system other symptoms include difficulty with reasoning and problem solving, difficulty identifying consequences of the choices they may have made. There are often poor judgment skills. A child with FASD may be very hyperactive or very jittery and may have rapidly changing moods or quick mood swings. There are also social and behavioral issues associated with FASD. A child with FASD may have great difficulty in school. Getting along with others may be a challenge while in school. May exhibit poor social skills while in school. May have difficulty or trouble adapting to change in their life or from switching from one task to another. This is often evident in school when a child may go from reading to math or from music to science. Other social and behavioral issues may include problems with behavior and problems in regards to impulse control. A child with FASD may have a poor concept of time and may have difficulty staying on task. Finally, children with FASD may have difficulty planning or difficulty working towards a goal that they are asked to do. Along with this, there are also tertiary symptoms of FASD. Now, tertiary symptoms can occur if, over time, the individual or the child with FASD experiences some type of chronic failure. Now, these following symptoms are preventable when primary symptoms are addressed appropriately and the individual, the child, is well supported with the necessary accommodations. Let me read this again, please. These following symptoms, these tertiary symptoms, are preventable when the primary symptoms are addressed appropriately and the individual is well supported with the necessary accommodations. These tertiary symptoms include possible criminal involvement, alcohol or drug usage and or addictions in the future, social service involvement. There may be legal system involvement. And finally, a child with FASD who does not have the proper accommodations may face or may result in a tertiary symptom of suicide. For more on suicide, please watch the training webinar here at the Foster Care Institute, Suicide and Children in Foster Care. As noted earlier, children with FASD often struggle in school. Some believe that 1 in 20 children in today's school systems are challenged with FASD. One mother of a child with FASD says this: he really likes to have ice, chewing ice, like a popsicle. If we can just sit him down and have a popsicle, it really helps to just kind of bring him down. And just like that, we'll settle him down enough that either he's talked through the situation or he'll forget it. So what about FASD or fetal alcohol spectrum disorder and children in foster care? It is estimated that up to 80% of children diagnosed with FASD do not stay with their birth families due to the high needs of the parents as well as the children. Some studies suggest that a rise in alcohol and drug use by women has resulted in 60% more children coming into foster care, the state care, since 1986. Indeed, we are seeing a rise of alcohol as well as opiates in our community, in our society, and the result upon children is devastating. It is estimated that up to 70% of children in the foster care system are affected with prenatal alcohol exposure in some fashion or in some way. Those children who come from families that may abuse alcohol in some fashion or are more likely to spend longer periods of time in a foster care environment, in a foster care home, in a foster care setting than other children. Those children in foster care from an alcohol abusive family stay in care 11 months on average instead of 5 months for other children who are coming into foster care not from an alcohol-related incident, and they are usually in care for an average 5 months. So you see the difference there. There are many common difficulties for children who suffer from FASD. These include trouble learning and remembering new information. They're forgetful of things learned previously. They may forget what was just told them. You might sit a child down with FASD and ask them to do something. And 5 minutes later, they do not remember what you asked them to do. The child may remember how to do something in one setting, but completely forget about how to do it in another setting or another environment. For example, If you ask a child to do something while you are home, and you ask the child to do the same thing, perhaps at another home, another environment, maybe at a restaurant or at a park or at school, the child may not remember how to do it. Or the child may learn something in school, but when the child comes home and you sit next to the child to help the child with their homework, perhaps in math, they may not recall how to do what they learned earlier. Sometimes those children with FASD may make up facts in order to compensate from them being forgetful or from forgetfulness. They maybe appear to be lying to you, but this lying is not intentional. Again, they're trying to compensate for forgetting something. Children with FASD may appear to be talkative, but in truth, they appear to miss most important themes of the conversation you're having with the child. They're missing the main points of the conversation. Those children diagnosed with FASD may not understand words with double meanings, or metaphors, or even sarcasm. They may have difficulty in taking turns in a conversation. There may be the difficulty for children with FASD for following out instructions. Despite you asking or repeating these instructions over and over out loud to the child, they have difficulty following it. This may be due to the processing of those instructions and remembering those instructions that you gave the child. They may not understand the directions unless told them slowly and through much repetition. They may miss key parts of the conversation, directions, or instructions. Again, if you're sitting down with a child with FASD and you're telling the child over and over again what you would like them to do, they might miss key parts of that conversation or the instructions you give the child. Children with FASD often have difficulty taking what is learned in one situation or one setting and applying it to another environment or another setting. Oftentimes, they may repeat the same mistake over and over again. If you have a child in school who has FASD, you will see this often. They repeat the same mistakes, perhaps with reading aloud or doing arithmetic. Children with FASD are often unable to recognize actions versus consequences and have trouble paying attention. They have trouble going from one task to another. They have trouble processing information. In fact, they process the information much more slowly than a child who does not have FASD. And they may think things through after they act it out. In other words, they often act first and think about the action afterwards. Again, actions versus consequences. There are other challenges with critical thinking, such as difficulty in planning or setting goals. They may find things difficult to talk about, like money or time or future actions. They may find it difficult to think about or reflect upon the choices or the actions they may have made. Bodily reactions in children with FASD include having very difficult and unusual sleep cycles. In fact, we saw a quote earlier from a mother who had a child with FASD in regards to sleep. A child may sleep in short time frames, may be awake much of the night. Child with FASD may not recognize bodily signs such as hunger or thirst. They may not recognize that they are thirsty. They may not recognize they're hungry. They may have to be reminded to drink some water. They may be also extremely sensitive to sensory stimulation. So, how does one diagnose a child with FASD? Well, in truth, diagnosing a child with fetal alcohol spectrum disorder can be very difficult because there is no specific one test for FASD. As a result, the healthcare provider will make a decision by doing a number of things. This includes looking at the child's signs and symptoms, asking whether the mother drank alcohol during pregnancy. As a result, the healthcare provider may diagnose FASDs based upon the mother's history of alcohol consumption and how the baby looks. Healthcare providers may also examine the baby to look for changes in face and eyes and upper lips. A newborn may show signs of alcohol withdrawal. This type of withdrawal, this alcohol withdrawal, can include shaking and high-pitched cry. If you've had a child in your home, an infant in your home who was suffering from alcohol withdrawal, then you know how challenging, how difficult, how exhausting it can be, not only for the child, but for the parent or for the caretaker as well. Other children may have learning tests. The healthcare provider may check for developmental problems. One child with FASD said this: "Kids with FASD have symptoms, not behaviors." Those individuals, those children with FASD, have their own unique areas that create challenges in their daily lives. They also have a unique set of strengths and gifts that, when nurtured and supported, demonstrates their unlimited potential in those areas. Some common personal and skill areas include being caring, articulate, friendly, musical, artistic, creative, practical, athletic, animal skills, nature skills, etc. Many who have been well supported are moving into fulfilled adult lives. Some are professional carers, have attended university, and are raising their own children. These past two slides, these quotes from these two slides, come from the FASD Network UK, and we thank them for the opportunity to present these quotes to you. We've looked at the signs and symptoms. We've looked at the causes and the various forms of FASD. We've looked at diagnosis of FASD. So how do we help children in our homes? Children placed into care. Children who in our lives have FASD. For tips and strategies on how to help, please watch the FASD Part 2 training webinar here at the Foster Care Institute. For much more, visit the Foster Care Institute at drjohndegarmofostercare.com. Follow me for much more about all things foster care, adoption, kinship, and parenting related on Facebook at Dr. John DeGarmo Foster Care Institute, at Twitter and LinkedIn at Dr. John DeGarmo. And if you have any questions about this email or anything else, please email me at drjohndegarmo@gmail.com. Now, hopefully you already have unlimited access to all of our training webinars, CEUs, our printable certificates, don't forget our free ebooks, and much more if you're a paid member of the Foster Care Institute. If not, consider becoming a member today. We go into detail about FASD in the book, The Foster Care Survival Guide, the essential guide for today's foster parents. You can buy that book and other best-selling foster care books at all good bookstores, and of course, order a personally signed copy at the Foster Care Institute. I wish to thank you for taking part in this webinar and learning more about FASD. I also want to thank you for caring for children in crisis. When we bring children into our homes as a foster parent, it is a very unique lifestyle that no one truly will ever appreciate unless they've been a foster parent themselves. Caring for children with FASDs can be difficult, can be challenging. At the same time, can also be so rewarding. So I thank you for caring for all children in crisis. For the Foster Care Institute, I'm Dr. John DeGarmo.